pleasant good evening to everyone. Tonight, we hope to unlock the science of the COVID-19 vaccine. In my presentation, I will aim to achieve three objectives. One, provide you an update on the COVID-19 pandemic, summarize our national COVID-19 vaccination implementation plan, and share some facts regarding the AstraZeneca Oxford University Covishield vaccine. Over the past 14 months, over 111.4 million persons have been confirmed with COVID-19, and over 24.5 million deaths have been reported globally. In the United States, over 28.2 million persons have been confirmed with this disease, and over 500,000 deaths have been reported in the USA. Amongst the CARICOM member states, over 100,000 persons have been confirmed and over 1,870 deaths have been reported. In the Federation of St. Kitts and Nevis, we have reported 41 confirmed cases to date. 40 of these cases have fully recovered. At present, we only have one active case. That case is stable and is being monitored as we speak. Regarding our national COVID-19 vaccine deployment and implementation plan, we are seeking to access enough vaccines to cover over 75% of our population. We have already received 2,000 doses of the AstraZeneca Oxford vaccine, and in short order, we expect to receive over 40,000 additional doses of the AstraZeneca Oxford vaccine. Access to the COVID-19 vaccine is crucial to curbing the spread of COVID-19 infections. Regarding distribution of the vaccines, at present, the Ministry of Health has strengthened its storage capacity for vaccines at the central medical stores, where our vaccines for the Federation is stored at the JNF General Hospital. Our vaccines will be transferred from these central points to the health centers, which are the designated vaccination sites. At present, during this week and next week, vaccines can be accessed at 7 of the 17 health centers in the Federation, and these are the Newtown Health Center, Bastia Health Center, Sandy Point, Tabernacle Health Center in St. Kitts, and in Nevis, Charlestown Health Center, Gingerland Health Center, and Combermere Health Center. We will be rolling out our vaccination program in 3 phases. In phase 1, we will be targeting the priority groups, the following priority groups. We will be targeting healthcare workers who are at high to very high risk of exposure to the SARS-CoV-2 virus. And these include all specialists and internists, doctors and nurses on the COVID-19 wards at JNF and Alexandra hospitals, personnel working in the operating theater, intensive care unit, accident and emergency departments, private practitioners, and the public health team who take the COVID-19 samples, health center nurse managers, and personnel who work on our ambulances. We will be targeting border protection staff working along the corridor of containment, and these include port health workers, immigration, customs workers, and taxi drivers, and sea transport operators, and frontline workers within our hotels. We will also be targeting the executive arm of government and essential workers outside of the health sector, including the police and defense force, Coast Guard, fire and rescue. We will be targeting older adults with chronic illnesses, illnesses including diabetes and respiratory conditions like emphysema and asthma, renal disease, and persons with autoimmune conditions. In phase 2, we will be targeting healthcare workers who are at moderate to high risk of exposure to the SARS-CoV-2 virus, and these would include personnel working on our medical wards, surgical wards, maternity units, personnel working in outpatients department, staff in nursing homes and in home care services, laboratory staff, pharmacy staff, staff in the X-ray department, and the mental health treatment center. We will be targeting older adults with comorbidities and middle-aged persons under the age of 60 with chronic diseases. We will also target socioeconomic groups, including low-income migrant settlements in St. Kitts and Nevis, disadvantaged persons registered in the social security benefit systems, persons with disabilities, low-income groups, hard-to-reach populations, and persons with mental health conditions. In the third or final stage, we will target all the staff working in the Ministry of Education from the early childhood phase through to the tertiary institutions. We will also target the other essential workers and personnel in the social employment groups, which include persons working in prisons, manufacturing industry, New Horizon Detention Center, the Children's Home, and the offshore medical schools. We will target the healthcare workers who are at lower risk of exposure to the virus, workers at the Carding Home, Flamboyant Nursing Home, and Ministry of Health administration and clerical staff. We will also include all other members or adults in our society, and this would include our younger adults and our middle-aged adults. We will be using an appointment system whereby individuals who have decided to take the vaccine, you are expected to call either 311 to secure an appointment, or you can go to your nearest health center in order to secure an appointment to receive the vaccine. The Ministry of Health will monitor everyone who would have received this vaccine for side effects through our vaccine safety surveillance program. Upon receipt of your vaccine, you will receive a vaccination card. Now, this card will be stamped after receiving the second dose of the vaccine. The Ministry of Health has developed a comprehensive communication plan, and the aim is to increase the demand for this vaccine. We hope to use traditional media and digital media platforms. We will be hosting stakeholder meetings, and we are requesting that our stakeholders call the 311 number to make a request. Your meetings will be scheduled. The goal is for everyone to be able to easily get a COVID-19 vaccine. Persons most at risk will be prioritized. However, while we work towards rolling out a safe and effective vaccine, we must continue the essential public health actions to suppress transmission and reduce mortality. And these include active surveillance for COVID-19 cases. We must continue testing. We must continue our COVID-19 prevention and control measures. Yesterday, we launched our program at the Newtown Health Center. We witnessed the vaccination of 70 persons. Today, day 2, 47 additional persons were vaccinated. So, at present, a total of 117 persons have been vaccinated in the Federation so far. The 311 operators have received calls from over 226 persons requesting appointments to receive their vaccination. At this time, I would like to share some additional facts about the AstraZeneca Oxford vaccine. Now, this vaccine requires that you receive an injection, an IM, intramuscular injection, in your deltoid muscle. And we ask all persons receiving this vaccine to allow for an observation period of at least 15 minutes after vaccination, just so that you can be monitored for any side effects, for any immediate side effects. You would have been told already that our dosing schedule includes 2 doses 10 weeks apart. Anyone with high fever should postpone vaccination. So if you are perchance experiencing a common cold with a fever, we ask that you postpone vaccination until you would have recovered. It is currently recommended that the same product should be used for both doses. So if your first dose involves the AstraZeneca Oxford vaccine, your second dose should be that same vaccine. Now, if you are pregnant, we advise or we recommend that you postpone vaccination until after delivery. Since the vaccine is a non-replicating vaccine, it is unlikely to pose a risk to breastfeeding children, to persons who are breastfeeding. So in other words, we recommend that if you are breastfeeding, you can take the vaccine. What are some of the common post-vaccine symptoms? So I have been monitoring the individuals who were vaccinated yesterday, and I would have called a significant number of these individuals, and they have reported the following post-vaccine symptoms: tenderness and pain at injection site, feeling cold or experiencing chills last evening. Some experienced mild fever, which was relieved by just simple paracetamol tablets. Some explained that they were feeling or experiencing malaise or fatigue. Some experienced body aches and pains, and some reported mild headache. Everyone who we called, they reported to work today. So this just provides a summary of some of the post-vaccine symptoms that you can expect when you when you receive your vaccine. Now, I just want to share some data coming out of the United Kingdom. In the United Kingdom, so far, about 33% of all adults have been vaccinated. The Public Health England and Public Health Scotland, they are conducting research whereby they are tracking those who had been vaccinated and comparing them against people who had not been. Public Health Scotland found that by the 4th week after the first dose of either the Pfizer-BioNTech or the AstraZeneca vaccine, the risk of being admitted to hospital had been reduced by 81%. The lead researcher in this study said that both vaccines were working spectacularly. And please note, we are rolling out the AstraZeneca vaccine. Ladies and gentlemen, it's important for us to continue the essential public health actions that we have been recommending over the past few months. We recommend that you continue to wear your face mask when in public places, maintain adequate hand hygiene, maintain adequate distance between yourselves and others when in public spaces. I want to leave you with this one question. Which would you choose? Would you choose the SARS-CoV-2 virus or the COVID-19 disease? Or are you going to choose the COVID-19 vaccine? In our case, the AstraZeneca Oxford vaccine. The science tells us that to date, over 111.4 million persons have been impacted by this virus, and over 2.5 persons have died. The science tells us that over 173 million doses of the AstraZeneca vaccine has been administered without significant side effects and 0 proven vaccine-related deaths. Ladies and gentlemen, personally, I am going to choose the AstraZeneca Oxford vaccine. I have an appointment for next week, Wednesday, March 3rd, when I will receive my first dose. I have full confidence in the safety and efficacy of this vaccine. In closing, I want to add that as individuals, we must make a personal decision. I want you to get the facts and make an informed decision. Don't hesitate, vaccinate. Vaccination ensures a healthy nation. Vaccination ensures that you protect yourself, your family, your loved ones, and our federation. I thank you.
And thank